Welcome back, everyone. About 80 million Americans have prediabetes. Roughly 30 million Americans are type 2 diabetics. And researchers say this underlying medical condition can have an impact in the fight against COVID-19, but there are some options to help. In tonight's Ask the Doctor.
It certainly does worry us, with so many of our patients being both overweight or obese and having type 2 diabetes, that our patient population is especially vulnerable.
Dr. Kent Sassy, a general surgeon with Sassy Surgical Associates, says while there's still a lot we don't know about COVID-19, it's becoming clear pre-existing conditions like type 2 diabetes and obesity can impact one's fight. In many cases, COVID attacks the lungs, which may already be compromised if overweight.
Even without the virus, people have a little bit lower oxygenation. They have worse pulmonary mechanics, meaning just the breathing mechanics are not as good. But there's also a thought that obesity and overweight has an inflammatory component.
And a hyperactive immune system seems to be playing a role in those who are getting very sick. Early research coming out of Northwestern University suggests vitamin D deficiency could also be adding to hyperactive immune response.
Much more research needs to be done, but it's kind of an intriguing thought that maybe boosting our vitamin D might put our immune system more in line with where it needs to be, and it's less likely to overreact to the virus.
Managing weight and blood sugar is also crucial.
Especially people who have prediabetes and people who have an early diagnosis of type 2 diabetes, we have a really good fighting chance of reversing it without surgery, at least for some years.
By increasing daily exercise and attention to nutrition. Plus, Dr. Sassy, who wrote the Type 2 Diabetes Cure, adds metabolic surgery yields incredible results for a majority of his patients.
In surgery, we're going in and changing some of the hormones that live in the stomach and intestines in ways that actually reverse the type 2 diabetes completely. So it doesn't happen for everyone, unfortunately, but the majority of people will see their blood sugars go down to normal and they're not on medications.
Criteria for surgery, like the sleeve procedure, includes having type 2 diabetes and people with a BMI over 35. Now, the 45-minute sleeve procedure can effectively change the body's control mechanisms and blood sugar regulation, leading to weight loss.
Somewhere 70, 80, close to 90% of our people will see a huge reduction in body weight, BMI. And then as a result, these risk factors go down. Their diabetes goes down, their obesity goes down, their lung mechanics improve.
Blood pressure as well, which may give people a better chance at fighting off diseases in the future.
So they become much less at risk for whatever comes down the road, including things like COVID.